so in this class we are going to talk about shift report. The goal of this session is that the CNA will give quality report on shift change. So your 3 learning objectives are: upon conclusion of the teaching session, the learners will be able to identify 3 reasons why a report is important. They will be able to demonstrate report to an oncoming CNA and express any concerns about giving report. So what is shift report? In healthcare, a change of shift report is a meeting between healthcare providers at the change of shift in which vital information about and responsibility for the patient is provided from the outgoing provider to the oncoming provider. So it's pretty much just a summary of all the important information that the oncoming CNA is going to need to take care of patients. Okay, so now that we know what report is, and I'm sure everyone knows because we're all CNAs here, what should you include in report? And I'll give you guys some free range to go ahead and answer. You guys have any idea?
The patient's name and age.
Yes, that's a good one. That's always the first thing you want to include. Anybody else?
Code status and isolation precautions.
Yes, very good. Would anybody like to include anything else to that?
How about they get up to use the bathroom?
Yes, mobility is always an important factor. Can we think of anything else we can add to this?
Their diet and if they have any wounds.
Yes, very good. So I think we hit the majority of them, but we're going to take a look at the list I have on here. Okay, so the first one, it's usually the first thing you say is the patient's name and age. And that's pretty self-explanatory. You want to say their code status, if they're on any isolation precautions, so if they're in contact, airborne, whatever kind of PPE they need to use. So their respiratory system, you want to always include if they're on any oxygen, so, and how many liters. So that if the CNA goes into the room and they see that their oxygen cannulas off their face, they can put it back on. Their level of consciousness, so if they're alert and oriented, or sometimes they may be combative because they're confused, and you want to make sure the oncoming CNA is aware of that. Mobility, so how many people it takes to get them up. That's an important one because this can be a fall risk if they don't mention this. So if a CNA goes in there and to take them to the bathroom and they didn't tell them how many assists there were, and they try to get them up by themselves, and they're really a 2 assists, and the patient could fall or the CNA could hurt themselves. So that's a risk for both the patient and the CNA. Okay, you want to mention if they're continent or incontinent, or how they use the bathroom, especially if they're incontinent, because the CNA has to go in there and change them and check them and stuff like that. So if they have a special diet or fluid restrictions, if they have any wounds or skin issues, the last time they had a bath, so at our hospital, everyone gets a bath on the med-surg floor. They get 1 bath a day, so the CNA needs to make sure they tell the oncoming one, like I gave 9 and 10 a bath, all you have to give a bath is like 11 or something like that. So you want to make sure they know who they need to bathe, and if they're due for a specimen collection, so they can get those in on time. Okay, so now we looked at what to include in report, so now we're going to look at complications of bad report. So one is the oncoming CNA will not be prepared to take care of patients. So for example, if a patient was a 2 assist and they try to get them up by themselves. So we talked about this earlier, either the patient could fall or the CNA could get hurt trying to take care of them by themselves. Okay, the specimen collection will be delayed. So sometimes when the CNAs come on, they don't have time to look at the charts before they do their rounds. So they're doing their rounds, making sure everybody's changed and taken care of. And they didn't get a chance to look at the chart and see that there was a specimen collection due. So the outgoing CNA should mention that, so that when they're doing the rounds, they can go ahead and get that. Or a patient could ask for a food or drink that they're not allowed to have. I usually ask, whenever they ask for that, I always ask the nurse like they're not on any diet restrictions or anything. But again, it saves time. If the CNA that's leaving goes ahead and mentions that. Okay, and then just delayed care in general. So if the patient's incontinent and say they didn't change them, or they were due for another change, and you didn't know that, and they were the last one down the hallway, so you didn't get them till later, and they've been sitting there. So And then also, the most important thing is patient safety. Okay. So your first learning objective was that upon conclusion of the teaching session, the learners will be able to identify 3 reasons why a report is important. So I'm going to give everybody a piece of paper and you're going to list the 3 reasons. This is kind of your post-assessment, but we'll talk about it after. And I'll give you 2 to 3 minutes to write what you think on there, and then we'll share. And this can be reasons why it's important, or maybe some more, you can add some more complications of that report. I'll give you about another minute. Okay, is everyone about finished with theirs?
Yes.
Okay. So let's start talking about these. So you were told to list 3 reasons why a report is important. Would anybody like to share one of theirs?
I put that quality report prevents falls.
Okay, yes, that's a good one. Again, patient safety is always priority. Would anybody else like to add anything?
Yeah. I think it helps the CNAs prioritize care.
Yes, that is also very important. Whenever CNAs come on, the first thing they should be doing is looking at their patients and prioritizing care, seeing who they should see first. And again, that comes from the offgoing report. That's how they're going to know how to prioritize their care. Do we have any questions on that? Okay, so we are going to move on to